Good morning. This is Paul Finkelstein, RealMedicareMan.com. That's Paul Finkelstein, RealMedicareMan.com. I'll put some more information up on the screen here. I'm Paul Finkelstein. I'm here to help you with everything Medicare. Hashtag everything you are afraid to ask about Medicare. You are in the right place at the right time. So if you're looking for some peace of mind, perhaps you're at the right place, right time. Bonus also, you'll get a book for free right here down below. Easy button for Medicare.com is a PDF book that you can download that my wife, or Mrs. Medicare, or yourmedicarelady.com, has written. It's on Amazon too. You can search for it at Sarah Finkelstein on Amazon. Instead of looking for a book, just type in her name, Sarah Finkelstein with no H. You can get the book there. I think it's a nominal price, like $15 or $18. Or you can get the PDF book right here just for listening to the third segment of 1,000 brand new segments, not like the old YouTube videos that are on YouTube already for all the other agents as well. Brand new 1,000 new videos coming up, lessons. Because how do you eat an elephant, after all? Do you know the secret? How you eat an elephant? One bite at a time. One bite at a time and one morsel, one nugget of information. So it's not overwhelming, because at 64 and a half years old, you too can be overwhelmed about all of the information. So my wife made it super easy. There's a 16 chapter book, straight to the point, all about Medicare education. The first two lessons and 997 more lessons to go. The first one was about Medicare Part A. The next one was about Medicare Part B. And guess what today is? It's about Medicare Part C. A, B, C, just like the alphabet, right? Try to make things easy, because I want you to eat the elephant one bite at a time as well. 5 to 10 minutes, really 5 minute nugget. And then we'll cover some commonly asked questions in every lesson. So if you miss it today, there'll be other chances to hear the other lessons of the most commonly asked questions about Medicare, as well as some real life testimonials from real people that we've helped enroll in Medicare and guide them and educate them so they can make a wise decision as well. So let's get right down to it for the Part C of Medicare. What exactly is that? We're going into let's tell what chapter is, chapter 4 in this amazing book about Medicare education by Sarah Finkelstein. You can get on Amazon or download right here at easybutton.medicare.com. So Part C, let's talk about it, and I'll be reading a little bit here in Sarah Finkelstein's book about Medicare education. Part C is a Medicare Advantage plan, a managed care, and is an alternative to original Medicare. In a prior lesson, we talked about original Medicare. What is that? So it takes the place of original Medicare and replaces it. So if you have original Medicare is what you get if you don't sign up for any supplement plan or any Advantage plan in Part C. And you might be wide open to lots of expenses, hospital, doctors, etc. So you probably don't want to have just original Medicare. Of course, it's better than nothing, but at the same time, the information you'll hear today, if you don't have today, you'll end up in dire straits. So no force or no pressure here. But even though you still have Part A and pay for Part B, which is out of the hospital, and Part A is in the hospital, Medicare Part C takes over and becomes your government go-to plan, your go-to plan for all your healthcare needs, and most of them include prescription drugs. So that might be one advantage, that the prescription drug plan or Part D is included in Part C. But here's your buyer's beware kind of thing. A Medicare Advantage plan can deny claims. A friend of mine told me that her fiance was denied heart bypass surgery. How can that possibly happen? Thankfully, his physician filed an appeal on his behalf, and it was granted, and it saved his life. These Medicare plans were born in 1997 under the Balanced Budget Act. At the time, they were called Medicare Choice Plus and renamed Medicare Advantage in 2003. Now you hear all about Medicare Advantage when you see those TV commercials with Joe Namath and Jimmy Guy jumping up and down. Wow, the savings you can get, blah, blah, blah. It's free. Well, have you heard the expression that nothing is for free? So some Medicare Advantage plans require that your care is coordinated through your PCP. A lot of Medicare agents might throw around these buzzwords or acronyms, PCP, MOOP, X amount of pocket, primary care provider. It's nice if you have a Medicare agent that talks in layman's terms and has a professional bedside manner that talks to you, the consumer, the friend, the family member as well. When you're a member of a Medicare Advantage plan, you need not present your red, white, and blue Medicare card, just your Advantage plan card. A trial right is available to anyone who wants to try out a Medicare Advantage plan for the first time. If they don't like it, they can go back to original Medicare and apply for a Medigap policy or supplement plan. To answer any health questions, this is called underwriting. So that's all there is for Medicare Advantage plans. There are some tricks, traps, and gotchas that you do want to have a Medicare agent or independent agent on your side, and we are certainly here to help you do that. YourMedicareLady.com or RealMedicareMan.com. You can catch Paul or Sarah Finkelstein. For those, also do get the book, Easy Button for Medicare.com. I'll leave this screen up just a little bit while longer so you can see the scroll coming across right now. Get the book absolutely for free, and we'll be doing the next chapter as well tomorrow. Here it is, Easy Button for Medicare.com. Download the PDF absolutely for free today, and you can get the book also on Amazon. Just search by Amazon by my wife's name or your MedicareLady.com, Sarah Finkelstein with no H. Thank you so much for joining me here today. Oh, I did promise it's only 6 minutes, so I have just a couple of moments left to talk about some commonly asked questions. Let's talk about those commonly asked questions that most of our customers like to ask. So most commonly asked questions of Medicare, let's add some additional ones that we didn't talk about yesterday. What did we not talk about? So here's the question, maybe apropos today. How is it that Medicare Advantage plans offer all the other benefits not found in original Medicare, and some of those plans have zero monthly premiums? Well, that's a great question. The reason is that for each Medicare beneficiary that elects to become a member of a Medicare Advantage plan, CMS, or the Centers for Medicare and Medicaid Services, pays the Medicare Advantage plan roughly about $10,000 a year, and that's how they're able to add all those benefits like dental, vision, gym, and more, depending on a particular plan. Here's another question. I love the control and flexibility offered by my Medigap policy or supplement plan. What happens if I move to another state? Great question. If you move to another state, you can possibly keep your policy, but it works throughout the nation. However, your current carrier may not be the most competitively priced in your state you move to. Contact your agent to see if you qualify to switch to another carrier. You will have to answer health questions, and that is part of the Medigap policy application. Medigap and Medicare supplement is synonymous. If you have certain health issues, you may not be approved for a policy with a new carrier. So buyer beware there. And then we'll end with a couple of more nuggets and testimonials from happy customers, perhaps, or people that love our education system that has cost you nothing. 1,000 new videos going up now. We're up to the fourth one tomorrow. This is the third one today. We talked about Medicare Advantage Part C. What did Bill Patella say in Delray Beach? He said, I have worked with Sarah for several years, and she has been a caring friend. Actually, let me put this up on the screen over here. These are real people, real testimonials. I think I spelled testimonials wrong there. My apologies. It's not testimonials, it's testimonials. We nailed it, though. First and last names, they're real people. How they got peace of mind from Your Medicare Lady and RealMedicareMan.com. So Bill Patella says, I have worked with Sarah for several years, and she has been a caring friend and valuable resource in sometimes a scary world of personal finances. Her intelligence and knowledge in this area has been a great benefit. I would recommend Sarah highly to anyone in need of trustworthy and devoted professionalism. Jocelyn Dillard said, I met Sarah at a women's roundtable. I immediately felt the warmth and genuine personality. She's very knowledgeable in her field and cares for each individual's financial needs. That's just two and a great nugget. I have time for just one more. It's 9:50 right now on the clock. Elaine Karniski says, I want to thank you for helping us with our Medicare supplement plan when we lived in Florida. When we moved to Tennessee, you helped us again, this time with great savings. Our policy renewed last month with a 23% rate increase. And again, you helped us save money. Thank you so much. We appreciate having you as an agent, and we gladly refer you to for our friends and neighbors. Thank you, Elaine Karniski. I'm Paul Finkelstein, real Medicare man. My wife is your Medicare lady. Thank you so much for listening to our third lesson in Medicare. Because how do we eat an elephant? One bite at a time. How do you learn the lessons about Medicare, especially at 64 and a half? We're here to help you. Thanks so much for joining me here today. I'm Paul Finkelstein. My wife is Sarah Finkelstein. And it's been great having you here. Learn everything you can about Medicare, hashtag everything you were afraid to ask about Medicare. Ciao for now. Have a super Saturday, and see you. Stay tuned for tomorrow's episode, for tomorrow's segment, the fourth lesson coming up tomorrow. Ciao for now. 97. Ciao for now, everybody.